What are you looking at?
Well, something COVID taught all of us for a generation is to be hyper-attuned to the risk of a pandemic. Given that the United States and the world really did not suffer a bad one for nearly 100 years, a lot of institutional knowledge and even fear around such an event was lost. Obviously, we all paid a big price for that when COVID came, where the policies enacted clearly reflected more the politics of the time and political idiocy than any plan based in science. It's been 2 years now, obviously, so you would think that with that lesson so fresh in our mind, that we'd be better. And yet, all current evidence regarding the latest so-called public health emergency indicates that, in fact, our political leadership in our public health establishment has become more captured by woke politics in absence of science than anything else. I'm writing, of course, about monkeypox, a disease which you can be forgiven for not knowing that much about, given that the way that the media has covered it, and can also be forgiven for being dramatically alarmed about, since the World Health Organization, for the first time since COVID, has declared officially this week a global public health emergency. First of all, let's start with the facts. What is monkeypox? It is a virus in the same family as smallpox, with familiar symptoms, but somewhat more mild. It is rarely fatal, but illness normally lasts 2 to 4 weeks, and it is very unpleasant to get. So far, with 14,000 recorded cases across the globe, only 5 deaths are attributable to monkeypox. How does it spread? Here's where the woke politics comes in. So far, in the latest study, detailed study of the 500 cases that had developed outside of Africa, 98% occurred amongst men who had sex with other men. In those cases, 95% of them had transmission route positively identified as sexual contact. And apparently what I just said is deeply controversial, with so-called activist groups saying that, and merely acknowledging this basic fact, they say is homophobic and it targets gay people for discrimination. Just so you don't think that I'm exaggerating, on the CDC website that I just showed you, there is not one single acknowledgement of this fact. It does not once mention the type of sexual transmission through which monkeypox is occurring. And because it's 2022, let me state this clearly. If you're a man who has sex with other men, you do you. I do not care. However, in my opinion, obfuscating that fact from you, that you are much more at risk of a highly infectious smallpox variant, is deeply insulting to you. It is also deeply insulting to the American public, who are trying to get this information, but cannot from official sources nor in the media. It's not just me who is saying this. Actual virologists and even gay activists are outraged by the current messaging. Benjamin Ryan, who himself is an LGBTQ health journalist and a member of the gay community, writes this in the Washington Post. The current CDC message, and those by public health authorities, including the media, saying anyone can get monkeypox, is so egregiously misleading it amounts to misinformation. He continues, quote, by reducing monkeypox risk to a simplistic binary equation, public health leaders are prioritizing fighting stigma over their duty to directly inform the public about true contours and drivers of this global outbreak. Ryan breaks down the overwhelming current amount of data which demonstrates worldwide and here at home that nearly all monkeypox cases have occurred currently between men who have sex with other men. But he also notes that state and local health departments are currently not collecting vital demographic data about people diagnosed with monkeypox in the United States, specifically because they are afraid of being labeled as homophobic. In fact, one of the reasons that we even have any good data at all on monkeypox is because in other countries, their brains are not as rotted by woke politics. Britain keeps robust data on transmission and demography of monkeypox patients, and their data has been a godsend for those who actually care about stopping this disease. Again, I reiterate a line from Ryan's op-ed. Public health officials cannot be expected to police the public's reaction to epidemiological facts. Gay men deserve to hear the unvarnished truth about monkeypox so we can take action accordingly. We are adults. Please be honest with us. I agree. Equality to me means treating everybody equally. The idea that the public cannot be told the truth about monkeypox transmission because it might make them homophobic is in fact homophobic. Do they really think that people are such children that's immediately what they're going to jump to? Furthermore, as Ryan writes, this is deeply infantilizing to gay men. We just went through an entire pandemic. All citizens were asked to make behavioral changes. People stayed at home, children were pulled out of school. Every American was told at one point to wear a mask when leaving their house. Yet, now when it comes to monkeypox, it is somehow homophobic to say, hey gay men, there is a disease that is spreading amongst you. To avoid getting it, be mindful when selecting sexual partners. If you do, wear a condom to prevent transmission. Yet, that is exactly what public health authorities refuse to say. In fact, the New York Times reports that when an epidemiologist wanted to advise gay men to reduce the number of sexual partners in New York State temporarily, he was shut down by his own department, who said in a statement that it was homophobic to dissect gay men's sex lives. In fact, in the days since they've rejected this sound medical advice for the public, here's what New York City authorities are now focusing on. They want the WHO to change the name of monkeypox because, quote, of growing concern for the potentially stigmatizing effects that the messaging around monkeypox can have on vulnerable communities. For God's sake, what about the people who are getting sick? Isn't that what we should all care about? This is insanity. It reminds me of when people said we shouldn't vaccinate old people first for COVID because they're disproportionately more white. Unfortunately, the so-called gay advocacy organizations aren't helping anyone. As Josh Barrow, who himself is a gay man, points out, GLAAD, the Gay and Lesbian Alliance Against Defamation, is releasing guidance for reporters encouraging them to lie and not say that men who have sex with other men are most likely to contract this disease. In fact, they incorrectly state in their guidance that, quote, a person's sexual orientation or gender identity does not put them at higher risk of infection. And that is a supposed gay advocacy group. Once again, that is a disservice. Let me tell you this, if I was a gay man, I sure as hell would want to know what the facts were. Acknowledging biological truths around disease is not homophobic, nor is it racist. Everyone knows black people are more susceptible to sickle cell. That's not racist. Tay-Sachs is a genetic disease that afflicts mostly the Jewish community, not anti-Semitic. Or myself, as an Indian man, I'm actually much more susceptible to diabetes and to gum disease, both of which I am combating right now. That's just how it is. Telling the truth is always the best strategy given health conditions. Failure to do so can only cost lives. Right now, there have been very limited incidents of household transmission of monkeypox to children. What's even more scary is that if public health authorities don't tell people the truth, people will not take precautions. We could have a full-fledged monkeypox outbreak. As we have learned with COVID, it could then mutate with so many other human hosts, and then everyone could be put at risk when we could nip it in the bud right now. So, Crystal, I mean, look, I get it's uncomfortable for people to talk.
Cable news is ripping us apart, dividing the country, making it impossible to function as a society, and making it impossible to know just what is true and what is false. But the good news is they are failing and they know it.
That is why we're building something new, a new mainstream, a healthier one, something more trustworthy, something that we are going to need in one of the most pivotal times in American history. We are building up here for the midterms, for the upcoming presidential election, but we need your help. So if you can help us out by becoming a premium member today at breakingpoints.com, we're trying to change America for the better and the entire world.
So what are you waiting for, guys? Go to breakingpoints.com and sign up and help us build a new mainstream.